Hi, everybody. It's Winifred Quinn. I'll give it one more minute and then I will start our official remarks. So I will be giving the remarks on behalf of the Center to Champion Nursing in America and Sue Hassmiller and Susan Reinhardt. And then I'm actually jumping off to go to a meeting, but our consultant, Peter Reinecke, who helps us with our work with folks at the federal government, he will stay on with our friends from the American Association of Colleges of Nursing and the National League for Nursing for the rest of the program, and he will answer any questions on behalf of the Center to Champion Nursing in America during Q&A. So with that, I'm going to go ahead and get started. So first of all, I want to wish each and every one of you, the nurses out there, and all of the nurses throughout the United States, a heartfelt best wishes for Happy Nurses Week. And on behalf of AARP's nearly 38 million members, I thank you for all that you do to help people stay well, be well, and to support families and friends of patients. So thank you so much. So good afternoon to today's webinar, Maximizing HRSA Funding Opportunities to Advance Nursing Workforce Diversity. It is great to be here with all of you. I am Dr. Winifred Quinn, and I'm the Director of Advocacy and Consumer Affairs with the Center to Champion Nursing in America, which is a joint initiative of AARP Foundation and the Robert Wood Johnson Foundation. And I'm giving you these welcoming remarks on behalf of the center, as well as our principal leaders, Drs. Susan Reinhardt and Susan Hassmiller. So the Future of Nursing Campaign for Action, also joint initiative of AARP Foundation, AARP, and the Robert Wood Johnson Foundation here at the center, is so excited to be co-hosting this webinar with our friends from the American Association of Colleges of Nursing, represented by Dr. Vernell DeWitty, who is the Director of Diversity and Inclusion, and the National League for Nursing, who's represented by our friend Dr. Janice Brewington, the Chief Program Officer. Also joining us are colleagues from the Health Resources Services Administration, Ms. Tara Spencer, who is Chief of Nursing Education and Practice Branch, the Division of Nursing and Public Health, Bureau of Health Workforce, and Ms. Melissa Lewis, who is the Chief Loan Repayment Branch, Division of National Health Service Corps, Bureau of Health Workforce. We're thrilled to have both of you. This is the first time we actually have somebody from the National Health Service Corps presenting at one of our webinars. So I'm so grateful for the time that Tara and Melissa are taking to be with us today. Tara and Melissa will be sharing with us current HRSA funding and also the National Health Service Corps Loan Repayment Program. So before we go any farther, I do want to mention we are recording today's webinar. If you miss a section or would like to pass it on to a colleague, which we highly recommend you do, we encourage you to find the recording by going to www.campaignforAction.org/webinars. I do want to mention that the biographies of today's presenters will be available with that recording on the website that I just mentioned. So today, our key objectives for the webinar are to describe current HRSA and National Health Service Corps funding opportunities, including the Faculty Loan Repayment Program and the America Rescue Plan. Identify strategies for faculty recruitment and retention by using the Faculty Loan Repayment Program, and to discuss essential requirements for submitting successful funding proposals to both. Lastly, I want to mention that, again, I'm not able to stay for the remainder of the webinar, but a colleague of mine, Peter Reinecke, he's staying to answer questions on behalf of the Campaign for Action. So at this point, I'm sorry to say goodbye to everybody. It was great to see the faces I saw. So thank you for joining. I hope it's a great conversation. I'm sure it will be. And at this point, I'm happy to turn over our program and awesome presenters to Dr. Vernell DeWitty. So Dr. DeWitty, please take it away. And thanks, everyone.
Thank you, Wen, for that wonderful introduction and setting the framework and the background for our time together today. It is my pleasure to co-host this event with my colleague, Dr. Janice Brewington of the National League for Nursing. As Wen mentioned, I'm with the American Association of Colleges of Nursing, where I am the Director for Diversity, Equity, and Inclusion. And now I'll ask Dr. Brewington to say hello to you and a few words before we get started with today's programming. Dr. Brewington. Dr. Brewington, can you unmute yourself, please? Thank you.
Sorry about that. Good afternoon. It is a pleasure to welcome all of you to this exciting opportunity to learn about HRSA and HRSA grants and how you can apply. And I bring you greetings on behalf of the NLN Chair, Dr. Patricia Yoder Wise, and our President and CEO, Dr. Beverly Malone. And it is an exciting opportunity and one that you won't have an opportunity again this soon. So we invite you to take advantage of the information and questions that you need to ask later. So thank you, and it's a pleasure being here to co-chair this with Dr. DeWitty and AARP and the campaign for to champion nursing.
Thank you, Dr. Brewington. And before we get started, I would like to invite you to enter any questions that you might have in the chat, and we will attend to those questions when we get to the Q&A portion of today's programming. And now, as we get started, I would like to ask a few polling questions. On your screen, a couple of questions will come out. They're appearing, and the first one you should see on your screen right now. We would like you to respond to the question and then hit the submit button. Once everyone has voted, we will release the results of the poll, and then you can see them. Okay, please respond to the question. Have you ever applied for a HRSA grant? Yes or no?
Dr. DeWitty, we're at about 84% who have voted. So let me know if you want me to close the poll or give it a few more seconds.
Give it a few more seconds and then release the results, please, Scott.
All right.
Thank you.
All right, it looks like people have stopped voting, so I'm going to close the poll and show the results.
Okay, here are the results. About 55% of you who are on the call right now indicated that you have applied for a HRSA grant, and 45% of you have not. And that's great. And hopefully by the end of this session today, you will be ready to start writing your first HRSA grant, or maybe to write the second one. Very good. So let's close this poll and ask the second question, Scott. And the second question appears on your screen. Have you ever been awarded a HRSA grant? Yes or no? Mark your answer and hit the submit button.
It looks like most have responded, Dr. Doherty.
Okay, let's release the results and see what we have. Okay, of those who responded, we have 34% who indicated they have received a HRSA grant, they've been awarded a grant, and 66% have not been awarded a grant. So hopefully this webinar is going to give you some great information when you get ready to write that next HRSA grant. And we have a comment in the chat box that someone received a grant as a co-investigator. And thank you so very much for that. And we can close the poll now, and that concludes our questions. Is that correct, Scott?
Oh, we have 2 more questions.
2 more questions. All right, let's go. All right. Oh, here we go. Here are the other questions. Which type of HRSA grant would be of interest to you and your institution? And here there are multiple choices. And I think you can only select one choice. So select your top interests: health careers pipeline programs, nurse faculty loan repayment, behavioral and public health, workforce diversity, or if you have other. And if you select other, would you please put a notation in the chat box so that we could see what your other interests might be. Mark your choices and hit the submit button. Okay, here are the results. Well, we see that Workforce Diversity Grant is the winner here, with 71% of persons indicating an interest in workforce diversity grants. The next would be Health Careers Pipeline Programs at 42%, then Behavioral and Public Health at 37%, Nurse Faculty Loan Repayment 26%, and we have 6% who indicated other. I don't see any notations in the chat box regarding what that, oh, SDS is the other selection. All right, so we know where the interests lie with our audience today. All right, Scott, the next question, please. And the next question is, do you have technical support at your institution for writing grants? And the answers, yes or no. And someone is asking us the question of technical support. We are making reference to, do you have someone in your institution who assists with grant writing or helping you assemble and prepare the grant for submission? Okay. All right, so let's see. 61% of our participants indicated you do have support, and 39% indicated that you do not. That's good information for us to know also for today's presentation. Scott, is there one more question?
That's it.
Okay, well, thank you all for giving us that background information to get us started today, and it helps with framing the discussion. And now I'm going to turn the presentation over to Tara Spencer. Tara, take it away.
All right, good afternoon, everyone. Thank you so much for taking the time out to join the webinar. And also thank you so much for the polling questions. I think that gives us a lot of insight into what the needs are right now, currently in the field. So my name is Tara Spencer. As Dr. DeWitty said, I am a branch chief within the Division of Nursing and Public Health. I'm also joined by my colleague, Melissa Lewis, who is also a branch chief. She's within the Division of National Health Service Corps. So today we're just going to give you an overview of our BHW, or Bureau of Health Workforce Grant Funding programs. And then that way it'll kind of give you a baseline into those programs that we fund within the Bureau. And we'll give you the baseline information in terms of funding, kind of what the purposes of the programs are. And then we'll have a Q&A after that. Next slide, please. So the Bureau of Health Workforce's mission is to improve the health of the underserved and vulnerable populations. This is done by community-based training of a skilled healthcare workforce, loan and scholarship programs that incentivize clinicians to work in rural and underserved communities, and health professions training grant programs that allow for innovative and flexible responses to the nation's emergent healthcare challenges. To support its mission of strengthening the health workforce and connecting skilled professionals to communities in need, BHW administers over 40 workforce programs with a total fiscal year 2020 budget of $1.6 billion. BHW resources positively impact every aspect of a health professional's career, from education and training to service in the community to continuing education. Next slide, please. Our programs serve as a catalyst to advance changes in health professions training that are responsive to the evolving needs of the healthcare system. With our nursing investments, we aim to provide service delivery and training to meet the needs of rural and underserved communities. This is done through an emphasis of quality training and practice opportunities that encourage innovative team-based and interprofessional approaches, academic, clinical, community partnerships, and longitudinal clinical training. More recently, we have invested in residency training programs for advanced practice RNs to prepare the NPs to serve in rural and underserved communities. In FY 2022, we awarded $17.7 million to 46 nurse practitioner residency programs. In addition to that $17.7 million, we provided $4.8 million to nurse practitioner residency programs to integrate behavioral health into primary care. Next slide, please. All of our nursing investments are funded under the statutory preference of the Title VIII Nurse Training Act, which was originally founded about 55 years ago, and it was enacted to anticipate a nursing shortage. So the administration, Congress, and the nursing community demonstrated a high level of support for nurses and provided recommendations to the Surgeons General. And those recommendations were weaved into legislation that resulted in the Nurse Training Act of 1964. The picture to the right depicts President Lyndon Johnson signing that actual Nurse Training Act of 1964. So that act was actually added to the Public Health Service Act in the same year, which we now call Title VIII of the Public Health Service Act, and that Title VIII legislation was reauthorized in 2019. Next slide, please. So this is just a snapshot of our fiscal year 2021 BHW Title VIII programs. We will give a brief overview of all of these programs that are listed here, but this is just kind of a broad snapshot of all of our nursing workforce development programs. Next slide, please. The Division of Nursing and Public Health. Next slide. The Division of Nursing and Public Health, or DNPH, as you will hear me call it, administers and provides oversight to nursing, behavioral, and public health workforce development programs. We operate out of an annual appropriated budget of approximately $319 million. We have 35 FTEs, and we provide our awards through several funding mechanisms of grants, cooperative agreements, as well as contracts. We support academic institutions, clinical facilities, community partnerships, and of course, our nursing institutions. We have 3 branches within our division. We have the Nursing Education and Practice branch, the Advanced Nursing Education branch, as well as the Behavioral and Public Health branch. To your right, you'll see some of the items that we put into our funding opportunities and allows us to demonstrate impact for our programs. Those are included are the expanding academic practice and community partnerships, enhancing curriculum and clinical training, as well as faculty development and other continuing education opportunities. Next slide, please. DNPH chairs the National Advisory Council on Nursing Education and Practice. The NACNAP, as we call it, provides recommendations to the Secretary on all things for nursing education and practice. Emerging themes over the last 2 years for the NACNAP include, but are not limited to, the social determinants of health, increasing nurse faculty, value-based care, and public health emergency preparedness. Next slide, please. Here you will find the nursing education and practice programs within the Division of Nursing and Public Health. We have 2 funding lines. We have the Nurse Education, Practice Quality and Retention line, or what you will hear me call a NEPQR. And we also have the Nursing Workforce Diversity line, or NWD. In FY20, we had 4 programs funded under the NEPQR line. The RNPC and VNPC programs prepare nursing students, military veterans, and practicing nurses to expand the role of the registered nurse in primary care community-based settings. We also have our Interprofessional Collaborative Practice Behavioral Health Integration Program, or our IPCP-BHI program, which integrates behavioral health services into primary care through nurse-led teams. In FY20, we funded a new program, the Simulation Education Training Program, that expands the use of experiential learning and innovative simulation-based technology to strengthen the capacity of public health nursing students. Next, we have our Nursing Workforce Diversity programs, or NWD programs. The parent program, or the base NWD program that we are currently recompeting, leverages evidence-based strategies to increase the educational opportunities of students from disadvantaged backgrounds, including racial and ethnic minorities underrepresented amongst registered nurses. We also have our E2, or Elder Care Enhancement Program, which supports students from disadvantaged backgrounds, but also focuses on increasing the elder care workforce in rural communities where there are health disparities related to access and delivery of care. Next slide, please. Next, we have our advanced nursing education programs. We have the advanced, they have 7 actively funded programs within this branch. New in FY 2020, the nurse practitioner residency program prepares NPs to provide primary care and behavioral practice in an integrated community-based settings. That is the NPR IP program that supports a 12-month residency that prepares those new NPs to practice in those integrated settings. We also have the nurse practitioner residency program, which also provides that 12-month residency program to support the new NPs, but that is specifically focused on just primary care in community-based settings. We have our ANU and A&E program that support the academic practice partnerships and traineeships to prepare advanced practice RNs to practice in rural and underserved settings. The new program also has a traineeship component to it that would support the traineeship for the APRN student. We have the Sexual Assault Nurse Examiners program, which we are currently recompeting this year, and that increases the number of nurses, nurse practitioners, and forensic nurses that are certified sexual assault nurse examiners. We also have the Nurse Anesthetist Traineeship Program that prepares RNs to become CRNAs. And we also have our Nurse Faculty Loan Program, which we are competing this year, that supports increasing the number of nurse faculty with a service agreement for loan repayment. Next slide, please. We also have our behavioral and public health programs. These programs, there were 5 programs that were funded in FY20. We have our Graduate Psychology Education Program that prepares doctoral level psychologists to provide integrated behavioral health to rural and underserved populations. We have our BWET, or Behavioral Health Workforce Education and Training programs that expand the behavioral health workforce serving in rural and medically underserved areas. This program supports both professionals and paraprofessionals, and we are currently recompeting both of those programs. We also have our Regional Public Health Training Centers program that strengthens the technical, scientific, and managerial leadership competencies of the public health workforce by providing public health training based on the needs of the 10 HRSA regions. We also have our OWEP program, or Opioid Workforce Expansion Program. So the professional track is to train behavioral health professionals in the provision of OUD and other SUD prevention, treatment, and recovery services in high need, high demand areas. This program also supports the development of behavioral health faculty skills and expertise in prevention, treatment, and recovery of patients with OUD and SUD. The OWEP Paraprofessionals program provides experiential training for students preparing to become peer support specialists and other types of behavioral health related paraprofessionals, with a focus on OUD and other SUD prevention, treatment, and recovery services. And lastly, we have our Opioid Impacted Family Support Program, which enhances the paraprofessionals' knowledge, skills, and expertise, and increases the number of peer support specialists and other behavioral health related paraprofessionals. Next slide, please. This is a summary of our funding for FY21. So this includes the number of awards that we were able to make and the total funding to support those programs. As you will note, there are programs, a number of awards and investments that have asterisks by them. Those are programs that were supported by the Division of Nursing and Public Health, as well as the Division of Medicine and Dentistry. Next slide, please. So we also have our Division of Health Careers and Financial Support. Next slide. The Division of Health Careers and Financial Support, or DHCFS, supports students, nurses, healthcare professionals, academic institutions, community-based organizations, and they all help to provide healthcare to the nation's underserved areas. In the DHCFS, they provide support to HRSA's mission to help serve the underserved with 12 health workforce programs, which I will also be discussing in this presentation. Next slide, please. One of those programs is the Nurse Corps program that helps to alleviate a critical shortage of nurses in high need, high demand areas across the US and its territory. Nurse Corps members receive loan repayment or a scholarship in exchange for a minimum commitment of 2 years of service at a critical shortage facility. In total, there are 1.9 million people that receive care from Nurse Corps clinicians in urban, rural, and tribal areas. Currently, there are over 1,900 Nurse Corps members that are serving at over 22,000 sites. Currently, there are 423 rural sites that the Nurse Corps clinicians serve. Next slide, please. The Nurse Corps Loan Repayment Program pays 60% of the outstanding loan balance for all awardees in exchange for 2 years of service. So there's also an optional 3rd year of service for participants to receive an additional 25% to their original qualifying loan balance for those 2 years, for that 2 years of service. Next slide, please. Then there's the Nurse Corps Scholarship Program, which provides funding to pay for nursing school tuition and fees. There's a 1-year service commitment in an eligible critical shortage facility for each year of scholarship support with a minimum of a 2-year service commitment. Next slide, please. So there are 4 programs within the Health Career Loans and Scholarship branch that provide revolving loans to health profession schools to help those students in financial need. These programs cover a wide range of health disciplines. There are no annual appropriations for these programs. They have been in existence for several years. And as the loans are repaid, these funds are rewarded. So they are revolving loan programs. Next slide, please. Specifically, the Nursing Student Loan Program was established to alleviate the shortage of nursing personnel and to assure that no qualified student was denied the pursuit of a nursing career due to lack of financial resources. These programs provide long-term, low-interest loans to full-time and part-time students pursuing a course of study leading to a diploma, associate's degree, baccalaureate degree, or graduate degree in nursing. Next slide, please. We also have the Health Careers Pipeline and Diversity programs. So the Pipeline branch supports the work and supports initiatives that aim to increase the diversity of the nation's health professions workforce. The Pipeline's programs include the Area Health Education Centers, or AHECs, the Centers of Excellence, or COE, the Scholarships for Disadvantaged Students, the SDS program, and the Health Careers Opportunities Program, or the National HCOP Academies. At this time, I will now turn it over to my colleague, Ms. Melissa Lewis.
Thank you, Tara, for providing that in-depth information about our nursing program opportunities. As Tara mentioned, my name is Melissa Lewis, and I serve as the Chief for the Division of National Health Service Corps Loan Repayment Program. And I am joined today by a few subject matter experts of the loan repayment program that will be helping to answer some questions. Next slide, please. So before we get into specific details about the National Health Service Corps loan repayment programs, I will be providing a general overview about the National Health Service Corps, and then I will get into the general eligibility and service requirements for our loan repayment programs, funding opportunities, and some resources and support that are available for our applicants. Next slide, please. So as mentioned, I do want to provide a brief overview about the National Health Service Corps in general, which is known as NHSC for short. The National Health Service Corps is another program that is administered by the Bureau of Health Workforce. The Bureau of Health Workforce, as Tara mentioned earlier, is within the Health Resources and Services Administration. Funding from the Bureau supports the National Health Service Corps and other programs that are designed to improve and distribute clinicians in the health workforce in underserved areas. The National Health Service Corps is the longest running program in the Bureau and provides loan repayment and a scholarship to eligible providers in exchange for commitment to serve in high need areas or health professional shortage areas, also known as HRSAs. I do want to provide a few key highlights about the National Health Service Corps, and they are as follows. We have more than 63,000 health professionals who have served since 1972. Approximately 16,000 National Health Service Corps primary care, medical, dental, nursing, and behavioral health practitioners currently serve in the National Health Service Corps. More than 1,000 students, including nursing students, are preparing to serve in the National Health Service Corps. NHSC providers care for more than 17 million Americans, and the NHSC loan repayment program has expanded several times to address health emergencies. For example, the Zika loan repayment program, the Substance Use Disorder Workforce Loan Repayment Program, and the Rural Community Loan Repayment Program are recent examples of this expansion. Next slide, please. Now, let us get into a bit more specific details about our loan repayment program. And we will start with the benefits of the loan repayment program. So here you can see a portion of the service obligation can be fulfilled by teaching. We also have flexible service options. So all participants or clinicians in the National Health Service Corps loan repayment program can serve in a full-time or part-time capacity. There's also increased access to primary care through services to rural communities in need. And most important, all of the loan repayment awards are tax-free. Next slide, please. So the fiscal year 2021 application cycle is currently open for the 3 programs that you see here. And these programs are our National Health Service Corps loan repayment program, which is our traditional loan repayment program. We also have the National Health Service Corps Substance Use Disorder Workforce Loan Repayment Program and the Rural Community Loan Repayment Program. The deadline to apply to one of these programs is May 27th, 2021 at 7:30 p.m. Eastern Standard Time. Next slide, please. We do provide a side-by-side comparison of our National Health Service Corps loan repayment programs so applicants can have a snapshot of the different award amounts and disciplines eligibility, as well as the service commitment, so that they can make an informed decision of the program that best suits their needs. So to highlight a few of the comparison between our programs. You'll see here that we allow for physicians, both MDs and DOs, nurse practitioners, physician assistants, certified nurse midwives, health service psychologists, licensed clinical social worker are among some of the disciplines that are eligible across all three programs. For our loan repayment program, the 2-year program that is, we also include dentists and dental hygienists, but those two disciplines are not eligible for our substance use disorder workforce loan repayment program, neither our rural community loan repayment program. Those two programs I just mentioned, which are our substance use disorder programs, do include pharmacists and registered nurses, along with certified registered nurse anesthetists, which is specific to the rural community loan repayment program. You will also see here the award amounts slightly differ. So for our 2-year program, we offer up to $50,000 for a full-time service commitment. For our substance use disorder workforce loan repayment program, we offer up to $75,000 for a 3-year full-time service commitment, and the rural community loan repayment program offers up to $100,000 for a 3-year service commitment. And again, just to reiterate, all three of these programs offer a part-time service commitment. Next slide, please. So I do want to go over a few of the basic eligibility factors for our National Health Service Corps loan repayment program, starting off with the citizenship requirement. So all applicants must be a United States citizen or national. They must be currently working or applying to work at a National Health Service Corps approved site. They must have unpaid government or commercial loans for school tuition, reasonable educational costs, and other reasonable living expenses. And they must be licensed to practice in the state in which their employment site is located. I am not going to go through the list of eligible disciplines again, but we do want to definitely highlight that our advanced nursing disciplines are highly welcomed in the National Health Service Corps. Next slide, please. So what funding opportunities are available for fiscal year 2021? So first and foremost, anyone or any applicant who's working at a National Health Service Corps approved site that is considered an Indian Health Service facility, tribally operated 638 health program, or an urban Indian health program will receive priority funding through an allotted $15 million that we have reserved for all applicants who are working at these types of sites. We also have additional funding that will allow us to award clinicians who would not ordinarily be funded at lower HRSAs. So one of the things that we're super excited to get the word out about is the historic funding that we received through the most recent COVID Relief Act, which is the American Rescue Plan Act. And through this funding, we received an additional $800 million. And this will definitely go a long way in supporting the largest National Health Service Corps field strength ever. This funding, as a lot of us are aware, was part of President Biden's initiative that he signed into law. Next slide, please. I just want to provide some additional information about our application. Just a reminder that anyone who is an advanced practice nurse or other eligible disciplines can apply to one of our National Health Service Corps loan repayment programs through May 27th, 2021 at 7:30 p.m. Eastern Time. You can also consult our NHSC website that has information such as the FY21 application and program guidance for each program. We also have the application link and specific fact sheets. Next slide, please. Additional application help is also available on May 20 from 9 a.m. through 5 p.m. Eastern Time. We do have all-day Zoom sessions where we have program experts answering questions about the current application cycle. Next slide, please. This is additional support and resources that are provided to National Health Service Corps applicants and participants who are awarded. We do have a customer care center. The number is shown on this slide, and they are available Monday through Friday, 8 a.m. to 8 p.m. Eastern Time, except holidays. We also have a National Health Service Corps website that has a wealth of information about the National Health Service Corps. We also host virtual job fairs where we connect skilled clinicians with National Health Service Corps approved sites that has job openings. We also have a health workforce connector that has a list of all of the openings at NHSC approved sites. You can also connect with us via Facebook, Twitter, and LinkedIn. Next slide, please. That brings me to the end of the overview about the National Health Service Corps, and I believe we will open it up for questions at this time.
Okay, thank you so very much for that wonderful overview of funding through HRSA programs, as well as the loan repayment programs. Earlier, someone had indicated in the chat box that they were interested in SDS, and I wonder if you might be able to say a few words about that.
I can, sure. So,
Okay.
so the SDS program is very similar to the Nursing Workforce Diversity Program. So the SDS is eligible to a lot of health professions, not just nursing specifically. So what they do is they provide the awards to the eligible health professions school in awarding, and they use that pool of money to award scholarships to students from disadvantaged backgrounds who have a financial need. So with SDS, that program gives a priority to the health professions and nursing schools that have at least 3-year averages of 15% of underrepresented minorities enrolled in full-time for the discipline for which the school is applying, 15% of their graduates practicing in primary care, and 10% of their graduates working in medically underserved communities. So those are some of the caveats for the SDS program.
Okay, thank you so very much for that. Another question is the overview, the information that you've presented today, is this information available in a centralized location someplace?
Absolutely. So all of our grant funding, we have a grants page within our on our website, and I can put that hyperlink there for you to be able to access it. And for Melissa's programs, the National Health Service Corps also has a website as well that I can put the link into the chat.
Okay, so those links will be going into the chat box pretty shortly. And here's another question. How do you apply to the Nurse Corps programs? What is the process?
So very similar to the National Health Service Corps, there is an open call for applications for the Nurse Corps loan repayment and scholarship programs. In addition to that opening applications, there is also technical assistance that comes with that. So the technical assistance will walk the applicants through the application, the call for applications, and be able to answer any questions that an applicant may have. Once the applications are submitted, they go through our review process and then the awards are made.
Okay. Another one of our participants asked, do you have any suggestions on how to be successful for Nurse Corps funding? They are indicating that they have never had anyone to apply or receive these funds. So do you have any suggestions about how do you interest people in this kind of funding or make the information more readily available?
Yeah, so number one, what I would do is sign up for all of the listservs. We have a BHW listserv where you can sign up and it will notify you of any funding opportunity that is available that comes through. Another recommendation that I would have is to also sign up for that same listserv in grants.gov so that you have kind of a two-way notification for that. In terms of Nurse Corps, the announcement is made every year when the application cycle for both the scholarship and loan repayment programs are released. My recommendation would strongly be, though, to make sure that you attend the technical assistance. And a lot of it also boils down to making sure that your service commitment that you are putting in your application is one that isn't in a high need, high demand, critical access location. That's definitely important. And then I would also reach out to, if you have any specific questions, reach out to the project officer for those programs with any of your questions that you may have.
Okay, and as a follow-up to that, is there a listing of where the eligible sites would be? For example, if someone wanted to apply, is there a place where they can go and see where the locations are to help them better make the decision?
We do have the BHW Workforce Connector that would help connect those providers. Now, once you have submitted your application and you're awarded, then there will also be assistance with helping you find a site if you need it. If, like, let's say you transition in between receiving funding and you need help finding a new location. But you can also look, there is what we call a HRSA score, or Health Professions Shortage Area score, that you can look up where you're working or where you're looking to work and provide that HRSA score. There is, like I said, also the Health Workforce Connector that actually has a list of sites that are looking for individuals to work, that you can go there and also search for employment opportunities as well.
Okay, now there are two questions that are somewhat related to each other. The first one says, can you share how or what made a previous application successful for getting funded? And the second is, what outreach and support does HRSA provide for community colleges who may wish to apply for the workforce diversity grants? So first of all, are there any supports to help with the application process? And then is there feedback when you are not successful, or some cues in terms of what you might do to be successful with your application?
So absolutely, for every notice of funding opportunity or NOFO that we release, there is a technical assistance. So there is a technical assistance call that is recorded. So you're able to go back to that technical assistance call in the event that you were not able to attend. There are also frequently asked questions that are posted, and every notice of funding opportunity has an assigned project officer. So if you have questions about the actual notice of funding opportunity, you can reach out to the project officer to be able to provide you answers to your questions. They will not tell you how to write your application or give you hints on how to write your application. But if you have questions that need to be clarified about the notice of funding opportunity, the project officer for that respective program would be your subject matter expert in terms of that notice of funding opportunity. In terms of how or what made previous applicants successful in getting funding, I think it boils down to whether you're new or returning. It's all about how your application is written, how you respond to the ask and the requirements of the NOFO. How are you demonstrating need, and how is that need and how you're going to address that need? What are the outcomes, and how is that threaded throughout your application? There is no formula, quote unquote, for new versus competing in terms of what made them successful or not. It really boils down to how responsive you are to everything that's listed in the notice of funding opportunity, and how the need is demonstrated throughout the application, and how it is measured against the review criterion. So the review criterion serves as kind of the rubric. It is the scoring mechanism that the reviewers use to rate your application. So I think that is the distinguishment. I think even if you are new and even if you are competing, it still boils down to those same things. There is no competitive or priority edge for an applicant that has been funded before versus one that has not. It really just boils down to how the application is scored by the reviewers based off of the response to the notice of funding opportunity.
And there's another, I think it's a clarifying statement here, and I'm not so sure what the writer means exactly, but it states, I'm more interested in how HRSA approaches community colleges in general, not a specific school or application. So I'm not so sure what is meant by how HRSA approaches community colleges. And I don't know, does that mean, are they looked at any differently, or are those applications considered alongside all the other applications that come in?
They are. There is no carve out specifically for community colleges. They are an eligible entity for majority of our Title VIII programs. So there is no different carve out or different anything that is different, as like I said, they are an eligible entity. We do provide outreach just like we are right now to stakeholder organizations that support community colleges, just like we do for all of the other nursing organizations. So it's a level playing field for all of our nursing institutions, whether they're community college or a 4-year baccalaureate program, public or private institution. Everyone's on the same playing field when it comes to our funding.
Okay, and there was one question that came up earlier that was asking whether or not, or when would the notifications go out about the workforce diversity grants, and whether or not they have, is there any indication when notifications will go out for the nursing workforce diversity applications for the most recent round of funding?
So those notifications have not been made at this time. That competition is closed and is undergoing the review process. So those notifications have not been made at this time. We are hoping to make those notifications on or before July 1st. We're aiming towards June if possible, but those notifications have not been sent out at this time.
I don't recall asking this question, and I'm seeing it now. How often are SDS grants available?
So all of our grant programs are based on appropriated funds. So some years, if there is a bump up in appropriations, we can recompete a program more often than the traditional cycle. Sometimes that's every year, sometimes that's every 2 years, sometimes that's every 3 to every 4 years. So it really is dependent on the appropriations that we receive from Congress.
Okay, and another question about allocation of funding. When you presented the chart in terms of where the funding dollars were going, is there any kind of a formula or a goal in terms of how the funding is allocated for the Nurse Corps or the NHSC in the American Rescue Plan, or is there any way by which the decisions are made about funding allocations?
So all of the fundings, because we are not mandatory funded, we are discretionary funded. So all of those funding lines, like I mentioned with the Division of Nursing and Public Health, programs are all allocated by Congress. So they specifically give us funding amounts for our programs, and those funds are competed until they run out. And so whatever that appropriation is that we are given, we allocate all of those funds until they run out. So there may be an instance where you know, we do get a bump up, and if we do get a bump up, we make those awards accordingly. But those are all appropriated by congressional funds and how they're allocated. When I did the presentation, for example, for the Nursing Education and Practice branch, we have two funding lines. So we have a NEPQR funding line, and we have a Nursing Workforce Diversity funding line. And so when we are giving those funds for allocation, we fund until those funds are gone, and that's how they're broken down. It's really not in our control.
Okay, we're pretty much getting to the end of our time here. I don't know, Dr. Brewington, I don't know if you're seeing any other questions there. While Dr. Brewington is looking, there's one here that came up, and I'll ask it. What does selected but not funded really mean?
So selected not funded means that your application was approved for funding. However, there is not enough funding for you to receive a grant award.
Okay, and the final question that I'm seeing here is, does RN to BSN only programs qualify for nursing student loan, for the nursing student loan program?
Because that is a baccalaureate level program, that program is eligible. It's diploma, associates, baccalaureate, graduate programs are all eligible entities. I would also check though, because again, these are all appropriated funds. There may be programs that may have been eligible for one competition, but not if those programs are specifically allocated for certain particular programs or specialties.
Okay. All right. Well, I think we are at the end of our time for questions. And as we get ready to close, I'm going to ask my co-host, Dr. Brewington, if you would like to add any comments here this evening.
Yes, this was just such an outstanding and thorough presentation by Tara and Melissa. And we just appreciate you providing the opportunity for all of the attendees here, because this gives them a lot of information, and it gives them access to information and where to locate information. So thank you so much for your time and effort in relationship to being here with us today.
Thank you so much. And as we get ready to say goodbye, I'd like to remind you that if you missed a section of the webinar, or if you would like to pass it along to a colleague, you can find the recording and any additional webinar resources by going to www.campaignforaction.org/webinars. We will also retrieve and put on the site the links to the web pages that were included in the chat box today. And once again, we ask that you be sure to follow the Campaign for Action on Twitter, join us on Facebook, and sign up for the bi-weekly update. Also, you can find those on the Campaign for Action. Again, we thank you for tuning in this afternoon, and we hope that the information that you have been provided will be helpful and supportive as we continue to advance the working nursing workforce diversity. Thank you and have a great evening.